how to use the Patient Communication Bundle, including AIDET and hourly rounding. Let's get started.
You are most likely familiar with the concept of hourly rounding. It is a structured process in which nurses and nurse techs routinely check on patients and proactively address their needs. During each round, the 5 P's must be addressed. These include pain, positioning, potty, proximity, and personal hygiene. Hourly rounding provides nursing staff with the opportunity to proactively meet patient needs, improve patient experience and safety, and reduce call bells. In order to effectively perform rounds, we will incorporate the use of AIDET, which is a patient communication tool. Let's review AIDET. AIDET stands for Acknowledge, Introduce, Duration, Explanation, and Thank You. Let's break it down a little further. Acknowledging a patient is an important first step in effective communication. When entering a patient's room, make sure to knock, ask permission to enter, make eye contact, and address the patient by name. Next, introduce yourself. Mention your name, title, experience, and/or special skills. We are reassuring our patients that we are the right people to take care of them. It's called managing up. Duration involves giving the patient an idea of how long something will take. Offering them this information will help reduce anxiety and build rapport. Explanation is helping our patients to understand. Let them know what to expect. Lastly, finish up with a sincere thank you. Let them know that you've enjoyed taking care of them and have appreciated their participation. Now it's time to get specific and see how you can incorporate this throughout your day. The first interaction you have with your patient typically begins with bedside report. Use bedside report as a way to proactively meet patient needs during a busy time of day. Some people consider this to be their first hourly round. Knowing how to use AIDET during this patient interaction will set you up for success. Let's take a look at some examples.
Are you ready?
Yeah, let's go.
All right. That's Mr. Smith. Came in 2 days ago for nausea, vomiting, abdominal pain. Mid with the right urinal stone. Planning to do lithotripsy tomorrow. NPO after midnight. NS at 100. Alert and oriented. Very alert and oriented. Yeah, that's it.
All right, sounds good. Check on you later. Didn't seem like Mr. Smith was involved in that interaction at all. Let's give it another try, this time using AIDET. Miss Smith, is it okay if we come in and do a
This is your
report?
nurse for today, Morgan. She's gonna take great care of you. Is it alright if I give her a report while we're here? Alright. We're gonna talk about what's getting ready to happen for the rest of your next shift. Alright, Morgan. So, this is Mr. Smith. He was admitted yesterday. Mr. Smith also has Zofran every 6 hours that we gave once at 4. Mr. Smith, is there anything else that we're missing? Anything you would like to add? Alright. Hope you have a great rest of your time here.
All right, Mr. Smith, it's a pleasure to meet you. I'll be back in about an hour. Is there anything else I can get you before I go? Okay, I'll be back to call you. You got your call bell?
Now, wasn't that great? Mr. Smith is at ease and trusts the team taking care of him.
Let's review AIDET. Acknowledge the patient by name. Ask permission to enter the room and make eye contact. Introduce the oncoming staff. Tell the patient how long it'll take and what you are doing. Finally, thank the patient for their time and participation. That's all there is to it. Now that you've met your patient, the next thing to do is your assessment. Use this time with your patient to explain hourly rounding and why it is so important. Remember to use AIDET to effectively communicate with your patient. Let's look at some examples now.
Hey, Mr. Smith, what's up? I need to listen to your heart and lungs real quick, okay? All right. You know where we are today? All right, sounds good. You know you're at the hospital? What year is it? All right, I'll be back to see you later, okay?
You can probably guess that was an example of how not to do it. The one-on-one assessment is time to get to know your patient and to let your patient know about you. Let's take a look at this next example to see how it's really done.
Hey, Mr. Smith, how are you doing? Good. My name is Morgan. I was just going to let you know I'm your nurse today. I was just going to kind of let you know how the day was going to go. So I'll be with you for 12 hours. I know that you're probably in a lot of pain, but you're on the right floor. This 5C has lots of urology patients. We get patients with kidney stones all the time. So if you need anything, just let me know, all right? All right, Ms. Smith, I'm going to do my assessment on you. I'm just going to listen to your heart and lungs, listen to your belly, just kind of look around, ask you a couple questions, but it should only take a few minutes, okay? All right, Mr. Smith, now that that's done, I just kind of wanted to explain something to you. So on 5C, we do something called purposeful rounds. Me and your nurse tech will come in, one of us will be in every hour on the hour to kind of ask you different questions. So we have pain, we'll ask you about your pain. We'll ask you if your call bell in reach, do you have your phone or your remote? Do you need to use the bathroom, the potty? Are you in a good position? Do you need us to help you move up or get in the chair? And then personal hygiene, like if you want to brush your teeth, comb your hair, or wash up. So the purpose of our purposeful rounds are making sure that we're being proactive, so that we can make sure you're being safe and that we can limit your time for waiting. Okay? All right, Ms. Smith, now that I explained purposeful rounds to you, is there anything I can get you before I go if I have the time? No? Okay, I'll be back to check on you.
Let's review AIDET. Acknowledge the patient by name and ask permission to enter the room. Introduce yourself and manage up. Mention your name, title, experience, and special skills. If that feels uncomfortable, manage up, wake med, or 5C and talk about how much we love our patients. Next, tell the patient what you're doing and how long it'll take. Make sure to explain hourly rounding and the purpose behind it. You can even show the patient the handout as a visual. Lastly, thank them for their time and participation. And that's it. Now that you've already explained hourly rounding to your patient, it's easy to follow through. Effective rounds mean less call bells, fewer falls and pressure injuries, happier patients, better quality, and an overall improved patient experience. These are the things we are striving for here on 5C. So remember to use AIDET and communicate effectively when doing rounds. Let's take a look at some examples.
You good? All right, see you later.
Let's try that scenario again, this time using AIDET.
Hey, Mr. Smith, can I come in? All right, it's Morgan, your nurse again. I'm just doing my hourly rounds. I just wanted to check on you. Remember these 5 Ps that we talked about earlier this morning during our assessment? So are you having any pain right now? No? Okay, do you need to go to the bathroom? All right, I see you got your water right there in your reach. Do you need me to fill it up for you? No? Okay. Do you want to change positions, put a pillow behind your back? You're okay? All right. I see you have your call bell in reach. If you need anything urgently, make sure you press it so we can come in here and check on you. I'll be back within about 2 hours, but you should expect to see the nurse tech in about an hour, okay? All right, thank you.
Let's review AIDET. Acknowledge the patient by name and ask permission to enter the room. Introduce yourself if necessary, but by this point the patient already knows who you are. Explain how long you plan to be in the room and what you are doing. Make sure to address the 5 Ps. Lastly, thank the patient for their time and participation.
Now you see how easy it is to incorporate AIDET into any patient interaction. Using AIDET during purposeful rounds will make you much more effective in meeting patient needs. Now it's your turn to try.